Okay, Assalamualaikum warahmatullahi wabarakatuh and good day everyone. Today I'm going to demonstrate on the anterolateral and also posterior abdominal wall. Okay, just however limitation about this model is that you cannot actually see the exact attachment, either distal or proximal attachment. But you can identify most of the muscle here. Okay, so we can ask you the muscles labeled, and then you have to answer the question according to the subsequent question is always about the structure, labeled structure. So that is in the OSP. So obviously this is the anterior abdominal wall, and you can see the six packs muscle. Okay, the six packs muscle, which is known as the rectus abdominis. And at the side here, you can see that this six-pack muscle, the rectus abdominis muscle, is covered by the rectus sheath. Okay, rectus sheath, and you can see the three tendinous intersection. Okay, separating these muscles into several compartments, and these three tendinous intersections, they are at three different levels that you can identify. The level here is at the manubrium sternum, this is at the umbilical region, and this is midway between manubrium sternum and umbilicus. So these are the three tendinous intersection. So let's talk about this muscle, rectus abdominis. So the attachment is here. Okay, it has two head, lateral and also medial head. Unfortunately, as I mentioned, you cannot see the exact attachment. But the lateral head is attached to the pubic tubercle, and the medial head is attached to the pubic symphysis. Okay, the pubic symphysis. Okay, and the other attachment is here, where it is attached to the manubrium sternum and also the ribs, not the ribs, but more on the costal cartilage. Okay, I don't expect you to remember in detail the attachment and also insertion, but only the important one, as I mentioned in my lecture. Alright, so the next, okay, perhaps I can just remove this. Look at the next muscle. Okay, be careful if you're given this model. Okay, this muscle here, in this side here, look at the fiber arrangement. Okay, the fiber is towards it is go towards upward, right? Like this, like that, the flow. Okay, not the flow, the fiber direction. Okay, whereas this side here, you can see that it is like it goes towards downwards. Okay, downwards. Okay, it's like this. So this muscle, if I labeled here and labeled here, definitely is not the same muscle, it's the different muscle. So the one that goes down like that is the external oblique aponeurosis, whereas the one that goes up like that is the internal oblique, sorry, not aponeurosis, this is external oblique muscle, and this is the internal oblique muscle. Okay, look at the fiber. And then how do you remember is when you can actually recall back the origin and also insertion. For the external oblique, okay, the origin is from the ribs. Okay, from the ribs. Of course, you cannot see the ribs here. Okay, but it is from above. The origin is the lower 8 ribs. Okay, lower 8 ribs from 5 to 12, and then it's attached down here at the again I cannot show you, at the anterior two-thirds of the outer lip of the iliac crest. Okay, and also to its own aponeurosis. This is the aponeurosis of the external oblique. Okay, innervation, I think you can look that in your lecture notes. Basically, it's from the T7 to T12. Okay, intercostal and also the subcostal nerve. And when you look at the internal oblique aponeurosis, the origin is more from below here. Okay, this is an important attachment that you may need to remember because it has a common origin with the transversus abdominis. Okay, it is attached to the anterior two-thirds of the iliac crest, not shown here, that's why I cannot show you. And also the inguinal ligament. Okay, there should be an inguinal ligament here, inguinal ligament, which is lateral two-thirds of the inguinal ligament. And then, okay, so perhaps I can put, okay, like this. Come on. Okay. So attachment also, just imagine there's an inguinal ligament here. So lateral 2/3 of the inguinal ligament, and also the iliac crest just now. And then this is anterior 2/3 of the iliac crest. And then you have to go backward, okay, but not shown. Here there is thoracolumbar fascia at this region. Okay, that is the common insertion for internal oblique and also the transversus abdominis. And one more trick, if you get this model, one more trick, if you still confused how to differentiate between external and internal oblique, you can look at the cross section here. Can you zoom? No. Okay. There are actually 2 layers of muscle here. 2 layers of muscle. So meaning that the external oblique has been removed. Okay, external oblique has been removed. So the innermost layer is the transversus abdominis, and then the outer layer here is the internal oblique. And if you look at the other side, you can see 3 layers of muscle. Okay, innermost is transversus abdominis, and then you have internal oblique, and the outer part is the external oblique. So that is how we test you. And then for external transversus abdominis, definitely I cannot ask you from this model, okay, except from this view, except from I have to show this view to ask you about the transversus abdominis. And you can see this is the transversus abdominis. It is transversely oriented, okay, transversely oriented. And again, attachment, the origin is similar with internal oblique, okay. That's the only origin that you need to know. And remember that it also actually forms conjoint tendon with the lower fibers of the internal oblique. Also, I cannot show you, okay, it's not shown here. But there's one important structure here that you can see very well, which I cannot show you in my lecture, which is this one. This is the arcuate line. This is the arcuate line, okay, which is the lowest fiber. It's the lowest margin of the posterior wall of the rectus sheath. So when I labeled this one, this is actually the posterior wall of the rectus sheath. Okay, posterior wall of the rectus sheath, and this is the arcuate fibers. Okay, I think that's all that you can see from this anterior abdominal wall model. But if you look from here, you look at the posterior abdominal wall, you can only identify the muscle, that's all. Okay, right. So where is, okay, this is the iliacus. Okay, this is the psoas major muscle. Okay, and this is the quadratus lumborum. Unfortunately, you cannot see the psoas minor muscle in this model. I think that's all for anterolateral abdominal wall. Please please also look at the atlas and also the complete anatomy software, the recording of complete anatomy software that I have already uploaded in the e-learning. I think that's all. All the best. Okay, thank you.